Welcome to the Wellness in Asheville Podcast, where we shine a light on the people, practices, and places that make this city one of the most inspiring wellness communities in the country. I'm your host, Travis Richardson, founder of Be Well Asheville, your local news source for health, wellness, and community events. In this episode, I'm joined by Dr. James Pinkston, founder of Asheville Non-Surgical Orthopedics and Regenerative Medicine. Known for his innovative use of PRP, stem cell therapy, shockwave therapy, and other non-surgical approaches, Dr. Pinkston helps people heal naturally and stay active without going under the knife. Dr. James Pinkston is a board-certified osteopathic physician specializing in neuromusculoskeletal medicine, with a clinical focus on non-surgical treatment of pain and functional disorders. He founded Asheville Non-Surgical Orthopedics in 2020 to provide a whole-body approach to regenerative medicine and wellness, integrating osteopathic care, injection therapies, and advanced technologies to support the body's natural healing processes. Now, in fact, I'm a patient and I actually send people to him all the time for musculoskeletal issues that can't be resolved with less of invasive techniques like massage, stretching, physical therapy, or even chiropractic in some cases. In this episode, I'm going to be discussing some of his offerings like PRP, also known as platelet-rich plasma injections, hydrodissection, which helped me a lot with my pinched nerve and neuropathy, and some other things. Well, let's just say that I'm a huge fan of Dr. Pinkston, and I think he's actually the hidden gem in Asheville, especially if you have anything like pain, like I do sometimes. So we're going to explore how his work integrates the best of science and holistic healing. And you're also going to find out why I think he's such an amazing person, partly or mostly because he is such a great listener. By the way, if you're going to listen to the end, you'll be given a really great freebie. So without further ado, let's dive right in. Dr. Pinkston, how are you doing today?
I can't complain, Travis. How are you?
Really good. Actually, my neck is feeling really good. And as you know, you've worked on me. That's been a problem point for me. And actually, it's one of the reasons I'm really excited to have you on today as a guest, because I think, for me, I've had a long history with pain, and so have a lot of the listeners. And being pain-free and sort of having good mobility is really, really important. So I'm really excited to talk about this with you today.
Looking forward to it myself.
Yeah. So just I wanted to share a bit about my story with you. I came in to see you and I was having neck issues. My history with martial arts goes way back, and I've had a couple of neck injuries when I was younger and never really took care of them. And before that, watched my dad struggle with back pain for 30, 40 years. And I always thought, this is just, what guys do. We just sort of, push through the pain until it got to be too much. And, I saw you and got some really good results. We did the manual therapy, and then we did hydrodissection, which I can't wait to get into to talk about that. And then even platelet-rich plasma injections. We'll talk about that as well. Before we discuss those topics, I'm just sort of curious if you could tell us a little bit about your background. I know we talked about it before, but how you got into regenerative medicine.
It's a hard decision figuring out what you want to do for the rest of your life. And I'll have to admit that a fair portion of my journey, I really didn't know. In the beginning, as a young high school athlete, enjoyed the weight room, grew up with the action figures of the time and movies. And I thought that, okay, maybe might like to do something with anatomy, which led me towards exercise science and eventually athletic training. So taking care of the athletes on the sidelines, prepping them for games, to go that one step farther. And that was when I learned about osteopaths. At that time, I had never heard the word, and I thought, well, a doctor is an MD, but actually there's DOs as well. And one of my teachers there, the director of the athletic training program, told me a really wonderful story about their son going to their pediatrician and having a physical exam where the doctor looked at the joints and then announced, your son's about to have a growth spurt. And they did. They could just tell by the hands on. And that was intriguing, almost magical and wizard like. And I thought that this is something that appeals to me, and taking care of people, working with your hands, learning to treat and diagnose in a way that often isn't done. We've lost a little bit of the maybe formal physical exam and touch in medicine. So I decided to pursue that, just osteopathy in general, and still wasn't sure which branch of medicine to go into. And I eventually decided that the mind was interesting. I'd try psychiatry, but quickly learned that that wasn't actually my area of interest, and that psychology was really more along my lines of thinking, and then the mind really, rather than what turned out to be mostly medication-based management. So after reevaluating old passions, I kind of came back to musculoskeletal. And I was lucky enough to find an opening in what's called neuromusculoskeletal medicine. That's the technical name for uh, my residency program. And that turned out to be the perfect change in direction for me. I had a really excellent mentor who guided me to develop what is now my practice today. He was also a business owner who offered these types of treatments, regenerative medicine. They also did ultrasound guided injections. They also did regular insurance-based care. So I had the contrast there. I saw the typical orthopedic, or in this case, non-surgical orthopedic care of mostly steroid injections and physical therapy, which is helpful, but to a point. And then I saw the regenerative medicine side of things. And that helped me decide what to do. It was also a point of encouragement that, yes, you can own your own practice and do your own thing. And that kind of formalized my decision. And I just had to figure out where to end up in the country.
Well, it's a really needed specialization that you provide. I don't have to tell you, you see tons of people coming in, I'm sure probably even younger and younger, with all kinds of musculoskeletal issues. I remember reading something about the average teenager's forward head tilt being like some number of degrees worse than, at 10 years prior, because of the use of cell phones and other things. For me, it's been a real game changer working with you, because I've told so many people about hydrodissection, in which I still like saying that name. I think it's a really cool name. The hydrodissection that I had with you, because it really illustrates the amazing power of this. And just to describe it for the audience, the procedure was amazing. Here I am laying on my stomach. I'm watching an ultrasound of the procedure being done. And you're like, here's your nerve, and here's how I'm separating it from the tissue that was essentially causing what you would consider the pinch or the compression. And once the procedure was over, I'm like, oh my God, I'm like, it's gone. I'm like, it literally worked immediately. It was incredible.
Yeah, hydrodissection is a really terrific tool if you have the appropriate imaging capabilities, which really has to be ultrasound to be able to see soft tissue and the nerves, because there's a lot of pain that is simply nerve entrapment. Something putting excessive pressure on a nerve. Sometimes it might be bone or disc when it's the spine, but once you get away from the spine, a lot of times it's just muscle, just connective tissue. And if you can get a needle down or guide a needle down to that point and inject some fluid around it, then you give it some breathing room, so to speak. You push the tissue away, you get rid of the entrapment. Also, the solution, which is usually a diluted sugar solution, it helps calm the nerve down. So it stops excessive firing, and it can also block what are loops of pain and muscle spasm, and pain leading to more muscle spasm. And you can break those cycles. And altogether, it works pretty well. And if you get it right, you can even get instant relief that doesn't come back. Sometimes it does, and you might need to do a little bit more, but it's it's an excellent alternative to something like a steroid injection, or a lot of people with issues in their peripheral nerves that would really mean away from the spine end up going just through treatment for the spine, the nerve roots, epidurals, and it leads to a lot of frustration because they don't get better and they wonder why, but really it's just because the problem is elsewhere.
How do you see the other modalities that are available to folks working like in conjunction with what you do?
I think it's pretty important to have a what I guess I would call a team approach. Usually, there isn't just some isolated problem. You take care of it, and it's gone forever. Usually, you need to evaluate. Well, why was that there in the first place? And are there some factors that are causing it to linger around? So I am constantly working hand in hand with physical therapy to work on posture and strengthening, deficits that could be corrected. And also, I bring in people who specialize in what's now being called lifestyle medicine, just healthy habits, sleep, food, drink, keeping stress low, socializing, and functional medicine when people need to dive a little bit deeper into other non-musculoskeletal medical conditions that could be contributing, or may just be coincidentally causing other issues in their life. So it's definitely not just me. I like to help people, but I also get a lot of helping hands along the way with the specialists that I've found here in Asheville.
What would you say is the most inspiring story of healing that you've had in your practice? What do you feel like has really been like, oh my gosh, that was even better than I thought it was going to be?
You do get some home runs like that, where you may be expecting modest improvement, and it can just be amazing. It's just the one thing that they needed. And hydrodissection does turn out to be that way sometimes. I've had a number of people that they they really couldn't do much of anything that involves straining. They're very active. They love to work out, but they can't, because anytime they strain, it creates these issues. And taking care of something, which to me seems very simple, and you expect potentially even partial results just given their presentation, and it's as if they've been miraculously cured. There's also really good stories about people with arthritis. That's a great example, because a lot of times we think that a worn down joint is what causes pain. It's just old, the cartilage is worn away. But really, it's the functioning. It's how the cells in the area function, and what signals do they send, and how do they operate, and are they doing the job that they're supposed to? So PRP and what's referred to as stem cell therapy, at least by layman's, also creates that all of a sudden eye opening. Oh my God, I had symptoms yesterday and now I don't. What did you do? What happened? When really a lot of this is just the body is relatively capable of addressing many things. It just needs a little bit of push in the right direction, and that's where things like regenerative medicine or other ultrasound guided procedures can come in.
If I ask somebody, have you ever heard of platelet-rich plasma? Not a lot of people have actually heard of it. Some have, but a lot haven't. Can you say anything as to why people don't know more about these therapies? And then also describe a little bit about like PRP and stem cells, how you do them. And also, I think we talked about shockwave therapy as well. I think people would like to know all three of those.
You would expect treatments like these, especially treatments that are so effective, to be relatively well known. And I think that a big factor in what is preventing them from breaking out, so to speak, and maybe being more popular and more utilized is really the insurance coverage of them, likely, because that's a big deciding factor for many patients when they're thinking, should I get treated or should I go to this physician or not? And even though they've been around for over 30 years now and used in high level athletics in the very beginning, it is becoming more popular and more commonplace. But um, I do think that it's not as accessible, and that's probably limiting the spread and the knowledge of it. But it is amazing. I kind of lump those treatments that you mentioned together in a term that I call regenerative medicine. That's how many people refer to it. But this would be regenerative medicine specifically in the musculoskeletal field. And the way it works is it's an injury, so to speak, and the body responds as it normally responds to injuries, except it's only amplified. If you have tissue that is damaged, a sprained ankle is a good example. The cells in that area release proteins that recruit the immune system. They recruit your local stem cells, what's just already in the body, and they're guided to the area and they begin to work. And you can initiate that by introducing your own growth factors and proteins in a more concentrated manner, or maybe some cells, or triggering the cells that are already there to release their own proteins. But that's what happens. It's just the signaling of the body that you're harnessing with either platelets that have the proteins and the growth factors and the cytokines that we use, or the cells, cellular therapy that do the same thing, or even the sound waves. It just causes the release in situ right there in the tissue.
Mm. Yeah, my experience has been phenomenal with all of the above. I'm actually the PRP that I had. I think it took a little while, actually, and I hadn't reported back to you, but my neck is still like, I have damage to my neck. I've got things going on I've got, my vertebrae is literally shifted in a direction that it shouldn't be too far. But I have noticed I feel it is more stable. It takes me it's harder for me to recreate the peripheral neuropathy that I've had with it. I can, but it's a lot harder. I have to actually like really kind of do a lot extra to make those symptoms appear. And I don't know if that's because of the PRP. I have to assume, because I haven't really changed anything else. It takes some time for the body to heal. And I guess, is that what you would anticipate? It can take longer than, just a week or two. It can take 4 or 6, even 8 weeks, as I've experienced.
Yeah, that's a good thing to keep in mind. It is a delayed process. It is a amazing process, but it takes time. You're definitely not going to get up off of the table after, say, PRP or cellular therapy and immediately feel better. In fact, you'll probably feel worse. There's usually a degree of inflammation that tends to occur as the body is releasing those proteins and activating the immune system. But then after that calms down, there's even going to be a period where you might wonder, Well, why did I do that? Because I feel the exact same as I did before. And that's normal. It just takes time to ramp up. It takes time for your body to respond, even on the order of months at times. Average around 4 to 6 weeks for people to really just begin to notice things.
Yeah, definitely. And another thing I was really impressed in working with you is just the way that you take time. That's something I think all of us are just so frustrated with the current medical practice. Traditional allopathic medicine, it's just like you get 5 minutes with the doctor, or they're like typing on the keyboard the entire time, and and you don't really get to see them or actually and look them in the eyes and tell them what's going on. And my experience with you is like we had a calm, collected, thoughtful dialogue where I felt like we were a team and trying to figure out what was next. There was no pressure, and like you tended toward wanting a conservative approach first and seeing how things would go before you suggested something more invasive, and I really appreciated that. And I guess what would you say for the kind of style that you have as a practitioner? Because it seems much different to me than almost any doctor I've ever seen.
Yeah, I am afforded the luxury to kind of craft that myself since it is my own practice. And other solo practitioners and people who are on their own probably are doing the same thing where they're not scheduling 30 patients in a day. They make sure that each patient, especially a new patient, has time to be heard, thoroughly examined, educated. But I think maybe heard is one of the most important things for people. And just giving them a chance to elaborate and say what's going on is something that's been strangely lacking. And patients express true appreciation when just spend a little time with them and be more of an individual. I mean, a real person sitting across from you rather than maybe the separation that could occur sometimes mentally between a practitioner and patient or client. So I think that's very important. I value that a lot. I am in my practice, especially maybe compared to a patient, I suppose I am the expert, but I I don't want it to appear that I am, you know, set aside, different, better than. It's just good to approach patients on equal footing, I think. And the belief as an osteopath that the body can heal itself also helps guide a lot of my practice and how I do things and the order I do things. You mentioned being conservative, and I think that's important. I see way too many patients who end up having what seems to be a totally unnecessary surgery. And that's just sad because then there's other consequences from that. And the first issue wasn't even addressed. So I like people to be heard. I like to take my time. I am very thorough. I am very conservative and careful because patients are devoting a lot to these treatments. It's their time, it's their money, and I really just want to be respectful of that.
Yeah, thank you. I know from my perspective, I definitely appreciate that level of caringness and thoughtfulness that you put into it, because I certainly felt it. And that's, of course, why I love sending people in need over to you, because I know that I can trust that you're going to do a great job on their behalf. So, you hear about regenerative agriculture, and there's this movement toward things being regenerative. I don't know that even myself, I don't know. I kind of have an idea of what that means. From your perspective, what does regenerative medicine mean to you, and where do you see that heading down the road?
Regenerative medicine is maybe applied to a variety of subspecialties, mine being specifically the musculoskeletal, which I can address. And it may be a little bit of a misleading name. I mean, regenerative indicating, okay, we can regenerate new, fresh tissue. And a lot of times that is the case, not all the time. But really, I would think of it as returning the body to more normal functioning. Some things do heal, literally. Soft tissue, connective tissue, tendons, ligaments, muscle, even nerves sometimes. But other things, you're not literally getting a new, fresh knee, for example, if we're attacking osteoarthritis. But just because you have what has maybe been described as bone on bone doesn't mean that it has to hurt. So regenerative medicine is establishing normal function, in some cases, actually regenerating tissue. But the baseline mechanism of it all is a response on the cellular level, on the cellular mechanisms, so that the body is doing what it's supposed to do. And you could think of it as a return to normal, or what you might call homeostasis, balance.
So when we think about the kinds of when we think about the kinds of conditions or like injuries and symptoms that would be applicable for coming in to see a practitioner like yourself, are there kinds of do you have good success with some kinds of conditions and maybe not as good with others?
It is a pretty broad range of diagnoses that my treatments could be applied to. And it's hard to make overarching statements, but generally the more common pathologies, at least in musculoskeletal system, arthritis, tendinopathy, ligament damage, they can do really well. In certain cases, depending on the cause, nerve problems can do excellent. In other cases where somebody's issues are due to, say, lifestyle or other comorbidities, and other medical comorbidities and or metabolic syndrome, that's going to be very difficult. And that's essentially fighting an uphill battle where the causes have not been addressed. The patient is really just looking for symptom relief. So those patients don't do as well. And I guess it kind of boils down to how healthy are you? When you're operating the way that you should, when you're taking care of yourself, at least the best you can in today's society, then you're really setting yourself up for a good outcome, for a positive response from treatment. And those who don't can still see good improvement, but it might not be as much as they want. It might not last as long as they want. If I maybe boiled it down again, it's hard to treat somebody without their help.
Yeah, I think that's sort of the paradigm that we're in now is basically where we've got to become more responsible for our health, because we're finding that traditional medicine actually can't really help keep us healthy. They can help once we're sick, but they fail miserably at keeping us healthy, and we're really responsible for that by our food choices, by how well we're sleeping, managing stress, and of course movement. Now, I was reading something the other day about longevity, because I'm kind of a geek on longevity, and I kind of like, it's like my hobby to watch what the biohackers are doing. And, like two of the best indicators for longevity is having a high VO2 max, which is basically your ability to utilize oxygen, that and grip strength. Well, those two things speak to mobility, because you obviously can't increase your VO2 max very well if you're not able to move, because you can't do the exercises that produce the the benefit. Same with the grip strength thing. If you aren't mobile enough to do strength training, you're not going to have probably a very good grip strength. Well, those obviously relate to longevity. And so, yeah, like, do you do any coaching around movement or how to do some of these things, or that's something you outsource, or how do you, because it's obvious that you can do a treatment, but there's all these other components that should be done side by side for best results.
They should. And in my line of work, especially the strengthening. So most patients, I end up recommending to pursue some sort of formal physical therapy, if not doing something on their own. And that's really the patient's choice. And I am constantly on a soapbox of strength training. If I talk a lot about healthy lifestyle, all the different components, but two things that I focus on heavily are the strength training and also the mental aspect of things. So I try to give as much guidance as I can on what people can do. And at the very least, be that nagging voice that's emphasizing this is important. In fact, this is one of the most important healthy behaviors that you could be incorporating into your life. So, that might as well be a on repeat for some of my patient visits. It may get annoying, but I just believe in it so very much. It couldn't be more important.
Everything I've studied around longevity says that if you're strong and have proper body mass, especially as you age, you're going to be much, much, much better off and able to handle all kinds of conditions that come your way better than somebody who's not. Let's wrap this up with a few what I call rapid fire questions here. So these are short answer form. There's 3 of them. I'm going to ask you the first one here. So one movement, if you had to choose one movement or exercise everyone over 40 should do, what would be that one thing?
If I had to pick one, it would probably be the squat. Just a extremely functional movement, strengthens a large portion of the body, especially the lower body, which is very important, especially as you get older. 40 is not too bad, but balance becomes an issue, and a lot of balance is just an issue of strength.
And yeah, I think I remember reading something about hormones too being impacted when you lots of cool things happen when you squat. So good one. One thing you wish everyone knew about pain.
I like to really emphasize that pain is not just a matter of damaged tissue. I think that's a great thing, a good take-home point for people. Just because you see something on imaging or MRI that is abnormal, defined by the radiologist who's reading it, doesn't mean that you have to have pain. Really, it comes down to function. We touched on this a little bit, but I think that is one thing I wish people understood a lot more, as well as the contribution of the psychological side of pain. Now, a newer model of dealing with or treating pain is the biopsychosocial. So you're taking in the body, the biology, but also the psychology and the social side of things, how you see yourself, how other people view you.
Yeah, that's a whole nother topic. Maybe for a future episode, we can do the biopsychosocial version of pain, because it's pretty fascinating. You have 2 people with the exact same structural maybe damage, and yet one person's experiencing great pain and the other person has no pain. It's like, why? It doesn't, to me, my brain just can't wrap my head around that. Interesting. Okay, last one. One misconception about healing that you wish more people understood.
So I think that the The biggest thing in that is that it takes time. It's not instant. We need to be patient. We are a very give it to me now, reward driven society. And it's hard to wait and see the light at the end of the tunnel, so to speak. But you do need to. It's just impossible for many things to recover overnight, but they still can. Just need to realize you're moving in the right direction and be okay with it.
That is an awesome way to end this show. Thank you so much, Dr. Pinkston. I really appreciate you coming on here and your time. Thank you.
It's been a pleasure. Thanks, Travis.
To learn more about non-surgical options for healing and performance, visit AshevilleNSO.com. Whether you're dealing with chronic pain, an injury, or just want to move better as you age, Dr. Pinkston's team offers science-backed therapies that help the body heal from within. Now, that special offer I mentioned at the beginning, all you have to do is mention this podcast, and you're going to get a free laser session consultation. This is a really amazing value, and it gets you the introduction to Dr. Pinkston, his work. You can ask questions and figure out what might be the best way for you to move forward. In itself, this is a really amazing session. If you haven't had lasers, they are great for pain relief. They help reduce inflammation and speed healing. Thank you for listening. To learn more about Be Well Asheville, visit BeWellABL.com. And don't forget to follow this podcast. You can catch the next episode and bring us along walking to the drum circle on a Friday, browsing arts and crafts at Grove Arcade, or driving out to Looking Glass Falls. If you loved what you heard, please rate and review the show. Your review helps others discover and grow our wellness community. You can check out Asheville Wellness news, events, and our newsletter at BeWellABL.com. Thank you for being the best part of our wellness community, and until next time, be well.